everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about meningitis, which we have already started in a different session. So I hope you have already referred to that video and you have understood the topic. So let us continue from there. So basically, in the last session, we have already discussed about what is meningitis and then how it is transmitted from person to person, and also what are the route of entry, and then we learned about the types. Well, so today let us start from signs and symptoms. So the signs and symptoms of meningitis depends upon the age of the child and also the causative agent, because we have already learned that there are different causative agent which might cause meningitis, right? So it might be caused due to any bacteria or virus. So there are several other reasons also. So definitely the signs and symptoms would also depend upon the age of the child and the causative organism. However, there are certain common symptoms which we would discuss now. So there would be flu-like symptoms, and the child will have fever, lethargy, and altered level of consciousness. Also, the child will have irritability, headache, photophobia, and stiff neck. Also, we can see Brudzinski sign and Kernig sign. So that we have already discussed how to check the Brudzinski sign and Kernig sign. And then there will be skin rashes and seizure also. Now, there are several other symptoms which can be present in neonates or infants. So there might be apnea, or the child might have jaundice, or also there will be neck rigidity. Abnormal temperature will be there. There might be hypothermia or hyperthermia, and also the child will have poor feeding. A high-pitched cry and bulging fontanelles and also poor reflexes will be present. And then there is a term called chronic meningitis. So what is chronic meningitis? Now, chronic meningitis is constellation of signs and symptoms of meningeal irritation associated with CSF pleocytosis that persists for longer than 4 weeks. So in that case, we will call it as chronic meningitis. Next, moving on to the diagnosis of meningitis. So here, in the diagnosis, definitely the first thing that we would do history collection and physical examination. And then there are diagnostic measures which can be done to confirm the diagnosis. So first we can do lumbar puncture. Now in lumbar puncture, what we would find out there, the pressure would be raised. Then they can also do culture for tubercle bacilli. And if there is presence of tuberculous focus elsewhere in the body, that is also a supportive diagnosis. So if they find out that there is presence of tuberculous focus elsewhere in the body, then they would do tuberculin skin test. And apart from lumbar puncture, there are also several investigations which should be done. So there can be complete blood count, blood culture, gram staining. Also electrolytes and coagulation profile, and along with these things they should also know about the liver and kidney function. Chest x-ray should be done, and then CT scan or MRI can be done. Well, next, moving on to the complications of meningitis. So there might be seizures, learning difficulty in children, and also there will be some sort of behavioral difficulties and hemiparesis and death. So next, let us learn about the management. So here first we will talk about the medical management. So the medical management is basically, it is based on supportive care. So there will be antiviral medications, there will be antibiotics and steroids. So in case if the cause is virus, then definitely we would go with antiviral medications, and if the cause is bacteria, then the child will be given with antibacterial medications. Also, if there is restlessness, for that sedatives might be given, and if there is fever, for that acetaminophen should be given, and along with these things there should be physical therapy. So again, with all these things, if it is a case of tuberculous meningitis, then in the treatment there should be anti-tuberculous therapy. And steroids should be given to reduce the cerebral edema and also to prevent subsequent fibrosis. So next, moving on to the nursing management. So first we will talk about nursing diagnosis. So here, what are the nursing diagnoses that we can formulate in case if we have a child with meningitis? So the first thing will be there will be ineffective gas exchange related to decreased tissue perfusion. Also, there will be impaired physical mobility related to fatigue. And then there will be imbalanced nutritional level less than body requirement related to dysphagia or nerve dysfunction. And also the child will have high risk for injury related to seizures episodes. So next, let us move on to the nursing interventions. So what are the things that we should do if we have a child with meningitis? So first we would focus on the respiratory function. So we have to maintain the respiratory function. For that, we have to assess the respiratory rate and quality frequently. So you have to constantly, monitor the child for respiratory insufficiency. And you should elevate the head of the bed, and also you should monitor vitals continuously. You should also make sure that there is adequate hydration and adequate nutrition, and you have to encourage the child for relaxation exercise. So this was all about meningitis and management of meningitis. Well, so let us conclude our today's topic here. So I hope you have got a better insight about the topic. Thank you.